Thank you for joining me today. I wanted to show a quick peek of our childbirth education and partner support class to give you a little preview of what is included if you sign up for this course. My name is Tia. I'm a certified childbirth educator and doula, and I will be the instructor for this course. This is a pretty big course that covers everything your basic childbirth education class covers, as far as those days leading up to labor, signs and symptoms of labor, the stages of labor, anatomy of labor, everything you know of the process of birthing your baby. We also go in depth into the partner support portion of the class that will show you tips and tricks to have an easier, quicker, less painful labor. Different things we can do, such as massage and counter pressure, hip squeezes, different positions you can move into at certain times to really help move baby down the birth canal. So it's really an all-encompassing class that goes beyond your basic hospital course of childbirth education. So I'm going to go in here and just show you a few slides and what the class will look like when you're taking it. So we're just going to go ahead and start at our signs of labor. So when you are taking one of my courses, you'll be able to see me up on the screen, and I'll be popping in and out of a larger view depending on what props I'm using at the time. And then I'll be using mainly slides to teach the remainder of the class. It's very interactive. We'll have time for comments and questions and discussion because I really do want it to feel like your traditional childbirth education class where everybody is together and we can all have that great discussion. So we'll start here with our signs of labor slide. So a few weeks to go before you go into labor, you might notice that your baby drops into the pelvis. This is also called lightening or engagement. You might hear comments that it looks like you've dropped or the baby is lower. You may feel like it's easier to breathe, and you might have to urinate more often because baby's head is putting all of that pressure onto the bladder now that it's dropped lower into the pelvis. You might also notice an increase of your Braxton Hicks contractions, also known as those practice contractions. They are not usually painful, though some people do report minor pain or discomfort. They feel like a tightening and can last anywhere from 30 seconds to 2 minutes. They're rather infrequent and don't seem to increase with a change in activity. So if you're laying down and you have your Braxton Hicks contractions and you get up and start moving around, those really shouldn't get any more painful or any more frequent. Same as if you are doing an activity such as walking around and you notice them, they won't really change if you lay down. Some things to help ease those Braxton Hicks contractions can make sure that you keep your bladder empty and that you are hydrated and drinking enough. Now, prodromal labor, which sometimes get confused with the Braxton Hicks contractions, is also referred to as false labor or early labor. I say there's no such thing as false labor. Those prodromal labor contractions are really preparing your body for the real thing. These typically happen every day at the same time, more commonly than not. When I am helping my doula clients, I get frequent texts, I would say between 10 p.m. and 12 a.m. that they are getting those prodromal labor contractions and they're rather uncomfortable. And we're both sort of talking through, is this it? Or is it just the practice contractions? You will notice the prodromal labor contractions. They are somewhat painful, but generally not as intense as true labor contractions. And they also don't intensify with movement generally. And they are more located in the abdomen instead of radiating from front or from back to front. So they don't really have that wraparound feeling that true labor contractions have. You may notice a few days or hours before labor that you start nesting. That's very common. We generally hear about you wanting to clean out your house or paint baby's room or, really just get everything in order, do laundry, fold baby clothes. That's very common. You might notice that you start losing your mucus plug. This is also called bloody show or show. And it happens when that cervix starts to soften, thin, and dilate in early labor, and then the mucus plug starts to fall out. You might feel extra discharge It could happen when you're wiping. You may see it in your underwear, or it may just be in the toilet after you go to the bathroom. It's normal for it to be tinged pink with blood, though you definitely do want to alert your provider to any bright red bleeding or anything beyond spotting. It's also good to note that your mucus plug can actually regenerate. Just because you lose your mucus plug does not necessarily mean that you are about to go into labor that day or in the next few hours, because it can keep producing and falling out. So it's not an imminent sign that labor is coming, but something to watch for and take note of. You also notice that you might have some diarrhea or some cramping. That's generally your body's way of cleaning out and getting ready for labor, so don't be surprised if that happens. It is important to stay hydrated during that time. You don't want to get dehydrated from diarrhea. If it gets to that point that you think that you are getting dehydrated, definitely talk to your medical provider about ways we can combat the dehydration. And our last slide that we will give a preview of is our rupture of membrane slide, also known as ROM. It only happens in about 10 to 15% of labor before the start of labor. So we know when we're watching TV or movies, we often see the first sign of labor as, oh my goodness, the water's broken, it's all over the floor or the bed, and everyone's panicking and running around. But that's generally not how it goes. Usually contractions will start and you will be in good, strong, active labor before your water breaks. But there are 10 to 15% of cases where the water is the start of labor. If your water breaks before you're in the hospital or birthing center, you do want to note a good acronym here is TACO, and that is the time your water broke, the amount of water that you see either on a pad or in your underwear, or if there is a puddle on your bed or floor. You want to note the color. Is it clear, yellowish, green, brown? There can be several variations, but your doctor is going to need to know what color it was. And then if there's any odor associated with it. Amniotic fluid is often described as having sort of a chlorine type smell to it, very light, but it definitely shouldn't be a foul odor or anything very strong, but you will want to take note of that to make sure that you let your provider know. When your water breaks and you contact your provider and they have you go into the birthing center or the hospital, they will be asking you these questions. So just try to remember this cute little dancing taco, and that will help you remember those things that the nurses are going to ask. It is good to keep in mind that the amniotic sac can at times reseal, or you may have had your water break, had that leaking, and then when you get to the hospital, you notice you're not leaking anymore. And that can also be from baby engaging and his or her head blocking that tear of the amniotic sac. So I often have clients where their water breaks, they have a lot of leaking, and then it sort of stops. And then as they progress through labor, or they'll feel baby rotate or move, and then they'll have another big gush. And that's just because that head can block the break in the water of the amniotic sac. So once your water breaks, you do want to note not to introduce anything into the vaginal area. No tampons, no fingers. You don't want anything in that area because there is that risk of infection at that point. When doctors do cervical checks or nurses, they often will use sterile gloves if the water is broken, just to keep everything as low risk for infection as possible. All right, that concludes my 3 sneak peek slides for our childbirth education. Like I mentioned before, we go into a ton of more information all through the stages of labor, the anatomy and physiology behind labor, and your hormones, and then also that great mesh of the partner support or doula support or whomever is going to be with you at that time, and different tips and tricks they can do to try to relieve pain, get baby into an optimal position, and different positions you can get in to encourage that. So if you have any questions, please reach out. You can find the link to sign up for this class at our website or in the event page. If you have any problems registering, please let me know, and I hope to see you in class. Thank you. Bye.